Hi, my name is Suzanne Gornell. I'm a clinical trials nurse at Memorial Sloan Kettering Cancer Center. I'm here to discuss the most common endocrine effects with checkpoint inhibitors and how we manage them. Some common side effects of checkpoint inhibitors are 1, thyroiditis, which is an inflammation of the thyroid, and 2, hypophysitis, which is the inflammation of the pituitary gland. Thyroiditis is monitored by regular blood tests each time you come in to be treated. Initially, patients become hyperthyroid, so there's an overreaction of the thyroid gland. The thyroid burns out and then leaves the person having hypothyroid. This can be a permanent side effect. Patients occasionally have symptoms with the initial flare of hyperthyroidism, such as tachycardia, insomnia, being unable to sleep, being extremely irritable. This occasionally needs to be treated with medication until the thyroid burns out. Once the thyroid burns out, patients have hypothyroidism, so a decreased function, and their thyroid hormone becomes elevated. It's typically diagnosed by labs as opposed to symptoms because we're checking the labs so frequently, and it does take some time for patients to have symptoms. But the most common symptoms of hypothyroidism are fatigue, cold sensitivity, dry skin. When the TSH is elevated, we start these patients on levothyroxine or Synthroid and refer them to an endocrinologist. Again, they will be on this medication indefinitely because this can be a permanent side effect of a checkpoint inhibitor, but it is very easily managed. Hypophysitis is another common side effect, which is an inflammation of the pituitary gland. Some symptoms of this are headaches, visual disturbances, thirst, frequent reurination. The workup for this is not, we don't do this commonly. So we do it if patients are presenting with these side effects, and we would do an ACTH test, another TSH test like we do for hyperthyroidism, and we'll test a luteinizing hormone and prolactin. These are all done by the endocrinologist. We may do them initially and then refer them to the endocrinologist. But it is typically managed with a corticosteroid. So these patients can be on hydrocortisone daily for an indefinite period of time. So it's typically given daily and it's an immediate fix. Patients start to feel better almost after the first dose of this hydrocortisone. Endocrine toxicities can sometimes be vague and symptoms are difficult to describe. So it's very important to know what the side effects are so that you can let your physician know how you're feeling. Although these side effects may be permanent, they're relatively easy to treat and lead to a much better quality of life and tolerability of treatment. I hope this information has helped, and if you're having any of these side effects or any further questions, please reach out to your nurse or physician. Thank you very much.